Very good afternoon, all our distinguished guests and speakers. Honorable Minister Dr. Jitendra Singh is here with us. I request all of you to be please seated. We are going to start this session very shortly. I request all our distinguished speakers to please kindly join us on stage. Honorable Minister Dr. Jitendra Singh. Radhika. Can we call her? Okay. Yes. Please. Can we request all our distinguished guests and speakers, please join us on stage. Can we have a round of applause, please, for our Honorable Minister? Welcome back, all our distinguished speakers and guests. It is truly our honor and privilege to have with us here today Dr. Jitendra Singh, Honorable Minister of State for Science, Technology and Earth Sciences, Government of India. Science and technology is really at the root of the transformation we need for a resilient future to extreme heat and provide access to sustainable cooling. It is a privilege to have with us the Honorable Minister. I kindly request the Honorable Minister to light the lamp and officially inaugurate the Global Heat and Cooling Forum 2026. Please. I request all our guests on the stage to join the Honorable Minister. We can get louder than this. We have lunch in half an hour.
Om Ganganapatiye Namo Namaha Shri Siddhi Vinayak Namo Namaha Ashta Vinayak Namo Namaha Ganapati Bappa Moria Mangala Murti Moria Om Ganganapatiye Namo Namaha Shri Siddhi Vinayak Namo Namaha Ashta Vinayak Namo Namaha.
I request Ms. Deepa Bagai, Country Head, NRDC India, to felicitate the Honorable Minister. Okay, wonderful. I now invite Manish Bapna, President and CEO NRDC, to share his welcome and opening remarks.
Good afternoon, everyone. Honorable Minister, distinguished guests, colleagues, and friends, good afternoon. Jitendra ji, very grateful that you're joining us today. Your presence sends an especially strong signal about the importance of this moment in India's leadership on heat resilience and cooling efforts and the related innovations that we aim to advance. Today, we heard quite clearly how fast heat risks are escalating. But this moment is not defined by risk alone. It's also defined by opportunity. Opportunity to rethink how we protect people from heat and how we deliver cooling that is affordable and climate friendly. And few countries are better placed to lead on this than India. India brings together deep scientific and engineering capability, a fast-growing innovation ecosystem, and extensive on-the-ground experience responding to heat. And we've already seen this transformation underway. India's cooling sector is evolving rapidly, driving new approaches, creating jobs, opening up what is estimated to be a $1.6 trillion investment opportunity around the world. And the Department of Science and Technology's leadership through sustained investments in research, in development, and manufacturing is accelerating these solutions in very tangible ways. We see DST's leadership in strengthening domestic manufacturing of efficient cooling technologies, innovation in advanced materials and better design, and building local skills and livelihoods across the value chain. And these efforts matter far, far beyond India. For example, imagine a future, say in 2030, when a family sitting in Jamaica or Kenya or even the United States is using a super efficient fan that was designed, engineered, and manufactured here in India. One can't overstate how important that conversation is at a moment when geopolitical risk, building resilience, building local value chains has never been more important. And the long-standing partnership between NRDC and the Department of Science and Technology has been grounded in that shared conviction that science, that innovation, that public purpose must guide how we respond to this moment. And as we move forward, it's worth keeping one thing in mind. The most effective solutions are the ones that are grounded in people's everyday realities, shaped by the communities that are meant to serve. And if we could stay focused on that, on people, on partnership, and on practical solutions, I'm confident that we can build a future that is safer, more resilient, and more equitable. On behalf of NRDC, very, very grateful. Thank you all for being here again today. Thank you.
Thank you so much, Manish. I now request Dr. Krishna Vats, Member and Head of Department, National Disaster Management Authority, Government of India, to give his special remarks.
Honorable Minister Sri Jitendra Singh ji, all the distinguished dignitaries on the dais, all our colleagues, participants, experts, people who have traveled from all over the country to participate in this workshop. We are extremely honored and encouraged to have Honorable Minister in our presence. As you know, the heat wave management follows a whole of the government approach. Within the NDMA, we strive to reach out to all the state governments, district administration for managing the preparedness aspects. However, a huge amount of effort has been made by the IMD and all the early warning agencies to improve the quality and precision of the heat wave management. We are now getting regular bulletins on heat wave. we are alerting the district administration based on the forecasts that are available. Not just that, we are also now including the information on humidity in our heat information. So there are several ways in which the information on heat is improving in terms of the quality and granularity. And that actually speaks of a very wider commitment to the overall issue of heat wave management. The heat wave management is actually reviewed at the highest level within the government. Today, Honorable Minister is with us. On 29th of this month, Honorable Home Minister is reviewing the preparedness for heat wave at the national level. Every year, Honorable Prime Minister reviews the heat wave preparedness. The review of the heat wave preparedness and mitigation at the highest level brings a huge difference to the way various agencies and institutions actually approach the issue of heat wave. It has really underscored the commitment of the government to how we need to reach out to the people who are most affected, the people who are most vulnerable, and how we need to bring greater sensitization among the district level functionaries to the various aspects of rescheduling work hours, improving the arrangements, and managing various utilities and services. So this is the approach that we pursue, and this is how we intend to improve the commitment and the overall scope of the heat wave management. We have brought in various dimensions. It is about managing health. It's about managing various provision of the civic services and paying particular attention to the most vulnerable sections. Honorable Minister is here. He would be guiding us and again giving us the advice that would be most helpful in strengthening our interventions. Thank you very much for organizing this event. Thank you.
Thank you so much, sir. I now request Dr. Nisha Mendiratta, advisor and scientist at Department of Science and Technology, to say a few words.
Good afternoon, everyone. It's my proud privilege and honor to extend a warm and heartfelt welcome to our extreme chief guest, Honorable Dr. Jitendra Singh, sir, who is Minister of State for Science and Technology and Earth Science, PMO, Atomic Energy, Space, and DOPT. Welcome you, sir, in this event on behalf of the organizers, who is NRDC, along with DST, NDMA, and CDRI. Sir is a visionary leader who is actively engaged in advancing India's science and technology landscape and promoting research, development, and innovation ecosystem in our country. His guidance across diverse portfolios reflects a strong commitment to governance, capacity building, and institutional reforms. We welcome you to GHCF 2026 Global Heat and Cooling Forum. And this platform basically, sir, is talking about various aspects which our country and globally everyone is facing with regard to rising temperatures and the impact on human health, life, and economy. And globally, I think all across the world, it has been felt that there is a rising global temperature, which are no longer a distant warning. They are just there and accelerating day by day. In India, it is deeply connected to our economy, health, and development. And attempts are being made to understand it thoroughly. In DST, through the Climate, Energy and Sustainable Technology Division, which is actively working on both climate adaptation and climate mitigation aspects, with programs like sustainable cooling, hydrogen, carbon capture, utilization, and storage, electric vehicle, and many more. We are implementing so many programs, sir, under your guidance, and we are very keen that we will be receiving your valuable guidance, not only for this forum, for this particular aspect, but also on many other areas which requires a rigorous research attempt. And sir, your presence here today is a matter of great pride and encouragement for all of us. And it is not only elevating the significance of this occasion, but also motivating all of us to tackle the pertaining issue of extreme heat events. Looking forward to hear from you, sir. Thank you.
Thank you so much, ma'am. Before we proceed, it is important for us to really reflect on this current moment, on where we are on the science of extreme heat and cooling. For this, we have two leading experts with us, Dr. Radhika Khosla, Associate Professor and Research Director, Oxford India Centre for Sustainable Development, University of Oxford, and Dr. Adele Thomas, Senior Director, Climate Adaptation, NRDC, and Vice Chair of IPCC Working Group 2. I turn to Dr. Khosla first for sharing with us the key latest insights on the science of heat and cooling. To you.
Thank you very much. It's wonderful to be here, and thank you to the Honorable Minister and to NRDC. I believe I have 4 minutes, so I'm going to be very brief, and I want to make 3 points about the science. We are all here because we recognize the urgency of extreme heat and of rising cooling demand, and I'm not going to belabor that point. But let me just tell you a little bit about where we are in terms of our studies at the moment. So what I have here is a new global data set of heating and cooling degree days that was recently released. And if you look at this graph, it tells us as we move from global mean temperatures of 1 degree rise to a 2-degree rise, and we hit that midpoint of 1.5 degrees. And just for context, we're probably going to hit that in the next 5 or so years. So we're very much moving towards that threshold. What we see is that the rise in cooling degree days, which is a measure of how much cooling energy we need, is going to be the most between 1 and 1.5 degrees. That means that it's really early on where we will see the largest shifts in climate intensity, and our adaptation needs are going to be the highest in that moment when we hit 1.5 degrees. And this is really important because it underscores the urgency for accelerated adaptation to rising cooling demand. This is not something we can defer, and it pushes this question of urgency really at the front of the table. The second figure here is part of the same study where we looked at for middle-of-the-road scenarios. So we just said that, if we go on in terms of business as usual, doing what we're doing, where do we end up? And what we found was that essentially the populations experiencing extreme heat are going to double from beyond 2 degrees C, from 23% in 2010 to about 41% in 2050. So there's going to be a doubling of the world's population that will be living under extreme heat. And that's going from basically about 1.5 billion to over 3.7 billion. And the countries that are largest affected, and the country that is largest affected, is India. This was out in Nature Sustainability, and it was really heartening to see actually that the government of India and the Ministry of Earth Sciences actually picked up this study. We didn't even send it to them. And there was a parliamentary response to this. So in a way, the government has actually taken on, this moves without my touching it. But if we can just go back to the previous slide, there was a ministerial response acknowledging India's role in being the country that is going to be most affected, but also laying out everything that the country is doing on governance with a particular emphasis on the role of the IMD. The next slide then is just to say what can we do about this. And what I want to show you here is the work that we did for the United Nations Global Cooling Watch Report in 2025. So this is from last year. It's an update of the work we did in 2023. And what we saw was that we said, if we look at cooling emissions in 2022 and we add to that business as usual, we add to that extreme heat, because what extreme heat is doing, it's actually raising cooling emissions, right? The more heat we have, the more we're using air conditioning, and it's raising up what we emit, and we add improved access, because everybody should be able to have access to cooling. And then we look at what are the emissions that we'll have, and how do we bring those down to a world where we actually have near zero cooling emissions, because that's the world we'll end up with extreme heat, but also giving thermal comfort to everyone. The 4 ways which we do this, and this is an update from the 3 ways which we said we would do this in 2023, passive cooling, low energy cooling, which is really an emphasis on fans. We're seeing this leapfrogging from no cooling to air conditioning, which is completely cutting out that intermediate category of low energy cooling, particularly fans, so really pushing on that. Best energy efficiency and rapid phase down of refrigerant gases. That brings us down to about 63% of global cooling emissions, and that last 30% or so is by decarbonizing the grid. So really, looking at this pathway allows us to be able to say this is what we need to do, but I want to tie this in with the slides before to say that extreme heat and cooling energy demand are 2 sides of the same coin of resilience, and we can't look at one and not look at the other. And so thinking of these in an integrated manner, both from a scientific lens, but also from a governance lens, are really essential, and therefore linking it to the question of equity and who we need to protect, when and how. Thank you.
Thank you so much, Dr. Khosla. I now invite Dr. Thomas to share with us the opportunities for heat adaptation at scale. Please.
Hi, everyone, and thanks to Dr. Khosla for really laying out those risks and impacts of extreme heat. And I'm going to build on that by focusing on the solutions. And specifically, what are we doing to adapt, and what does the evidence tell us about what actually works? I'm going to be drawing from a global assessment of adaptation that I was part of for the IPCC's 6th assessment report, with a particular focus on the Global South and South Asia. So for the 6th assessment report, I was part of a team of scientists from around the world, and we assessed thousands of papers that looked at adaptation actions worldwide. And from our assessments, there are 4 key findings that I would like to highlight. The first is that adaptation planning has increased globally across all regions. At least 170 countries and many cities now include adaptation in their climate policies and planning processes. Climate services and decision support tools are increasingly being used, and pilot projects are being implemented across sectors. This represents real adaptation progress. The second is that despite this activity, major adaptation gaps remain. Most observed adaptation that we see is still very fragmented. It is small in scale. It is incremental and sector-specific. Much of adaptation focuses on planning rather than on sustained implementation, and it is designed to address current or near-term risks rather than longer-term extremes. In short, adaptation action is growing, but not yet at the scale or depth that is required to significantly reduce climate risks. The third finding was that adaptation is unequally distributed. Observed adaptation is concentrated in some regions and population groups, while gaps persist elsewhere. These gaps are driven by widening disparities between the costs of adaptation and the finance that is actually delivered. and the largest gaps exist among lower income populations in the global south, as we are all aware. At current rates of action, adaptation gaps will continue to grow. And the final finding is that the burden of adaptation is falling on households and individuals, and we see this most concentrated in both Africa and in Asia. Without the financial support that they need, people are making adjustments to how they live in order to cope with escalating climate impacts. This creates further adaptation gaps between those who can afford to adapt and those who cannot and continue to suffer. And I think this really highlights what Sheila Patel said in our opening plenary. So what does this mean for extreme heat? The short answer is that we already know what to do. We've already planned it out. We've already tested it in pilots. What is missing is the political will, the institutional coordination, and the finance that is needed to do it at scale. In the sixth assessment report of the IPCC, we were very clear on this point. With high confidence, we found that early warning systems, when combined with heat action plans, public communication, and health system preparedness, reduce heat-related mortality. Where these systems are institutionalized and locally tailored, they save lives. And critically, integration matters more than any single intervention. Fragmented responses underperform even when the individual technical components are sound. And speaking of integration, this leads to the final framing that I would like to highlight: climate resilient development. In the IPCC, this means pursuing development pathways that reduce climate risk while also improving well-being and equity, and while keeping global warming as low as possible. Applied to extreme heat, this goes well beyond short-term responses or even standalone adaptation. We have heard a lot here about addressing heat and cooling being flip sides of the same coin, and Climate Resilient provides us a framework to address that. It shows how sustainable development, climate mitigation, and adaptation must work together. Under a climate resilient development lens, heat is no longer treated as an occasional emergency. It becomes a permanent design factor, shaping how we plan cities, housing, infrastructure, labor systems, and energy pathways. This means that we must mainstream heat into development planning, treating it as a recurring condition rather than a shock, and also consider how we do this in a way that limits emissions that drive rising levels of heat. I think that heat can serve as a blueprint for how we apply climate resilient development for other climate hazards, and I think that this provides a real opportunity to transform how we think about climate action and development. So I'm very glad that we're having these discussions here, and I look forward to the rest of the forum. Thank you.
Thank you so much, Dr. Thomas, really nicely explained. It's a deep honor to have with us Dr. Jitendra Singh, Honorable Union Minister for State for Science and Technology, also Union Minister of State for Earth Sciences, also Minister of State for Prime Minister's Office, Personal Public Grievances and Pensions, Department of Atomic Energy, and Department of Space. He also serves as the Vice President of CSIR. Dr. Jitendra Singh is a popular diabetes specialist of international repute. I see you here, sir, now, so it's a cue for me. I request you to please deliver the inaugural address.
Something more to say? It sounds flattering. Thank you for your kind introduction. On the dais with me, my colleague from the Department of Science and Technology, Dr. Nisha Mendiratta, Dr. Thomas, Dr. Vats, Dr. Radhika Khosla, whom you heard just now, and of course our very senior and respected Mrs. Bagai and Mr. Manish, representatives of different organizations, ladies and gentlemen. At the outset, I have to, yes, of course, I am glad to be here. I think it's for the first time that I'm getting myself acquainted to a forum like this. And I must compliment you for having come out with this idea of having NRDC India, the Natural Resource Defense Council, which also brings together DST, the NDMA, the Coalition of Disaster Resilience Infrastructure, that is the CDRI, and having organized this important theme, Global Heat and Cooling Forum. And this Global Heat and Cooling Forum, and the theme of this discussion is something which affects each one of us across the globe, fortunately or unfortunately. But I think that's also not right. The right expression would be fortunately and unfortunately. Because unfortunate because it doesn't spare anyone. Whether you live in the west, the east, close to the seashores, or in the main heartland. And fortunate because it has brought all of us together and brings the whole world together. So that is one of the virtues of any adversity, like we saw during COVID. Some of my colleagues who had settled in the West for decades together would call up in the middle of night, and who had always shared their contempt for the Indian systems of medicine would call up in the middle of night and ask, have you come out with an immunity booster in Ayurveda or homeopathy? So when faced with the threat of death, you get united. And that is one occasion. So I think this is going to be also a lot of improvement in how best we integrate despite our existing or non-existing contempts, mutual skepticism, and also mutual cynicism sometimes. Now, climate change, as was being mentioned and also in the two presentations, is an unequivocal global phenomena. And we are simultaneously discussing extreme heat and also sustainable cooling. And for a country like India, and why we are discussing? Maybe, of course, for one reason that was we elucidated through the presentation that this phenomena has now caught up in a big way, but also because the level of awareness among the mankind has risen. In the same city of Delhi till about 4 decades back, you never knew what is heat tolerance or extreme heat. And you also didn't talk about the access to the cooling phenomena that Dr. Radhika was mentioning, because there were no air conditioners, no coolers. People walked in the middle of heat wave and happily survived. Of course, one explanation could be that the heating phenomena was not as critical or as moribund as it is today. But it is also simultaneously not only the question of sustainable cooling, but also the sustainable human resilience. And the human thresholds have also undergone a change, possibly because of the access to some more or some other amenities and conveniences which did not exist in the bygone decades. But nevertheless, now that we are aware of it, as the proverb goes, the eyes see what the mind knows. Now that the mind knows, the eyes have started looking for it. As long as the mind didn't know, the eyes were also shut. And you lived in a blissful ignorance. But now that we know also understand how it impacts the health, the environment, the food security, and also by that, in that way, the overall economy of the nation. But I think most importantly, the health part of it. Because you heard the presentation trying to bring out the global trends. But what is specific to India? Very often I keep saying we need Indian solutions for Indian population, Indian treatment for Indian patients. From the point of view of heat and cool for the country like India, the peculiarities are, if you see climate-wise, we have both. We have extreme heat and we have extreme cold, which may not be so in many countries. And we have simultaneously all the weathers existing in the same country at the same time. You may have summer if you go to Kerala, and you may have winter here. So the acclimatization also becomes a challenge for the professionals who are frequent commuters, which may not be so in a homogeneous country like Europe. So your remedy, your solution has to be different. Because if I simply wake up from Leh Ladakh and walk into humid Kerala, I need a different kind of protection mechanism which may not be applicable to a European. The other part is that we have all the diseases happening in this country simultaneously. For a long time, the West saw us as a country beset with tropical diseases. The entire Indian subcontinent, the undivided India, which consists of India, Pakistan, Bangladesh, etc. And many of the European researchers, because we were part of the Commonwealth, came to India to do research on tropical diseases and the effect of these factors like heat, etc., on tropical disease, because they didn't have. In fact, for many years, in the All India Institute of Medical Sciences, till I think about 1990s, you had interns soon after doing their medical graduation in the medical school in UK. They would come here for about 2-3 months to be posted in leprosy wards, tuberculosis wards, etc., etc. And many researchers here, if you go to Madras, this is now known as Chennai, outside the General Hospital, when you walk towards the pathology department of the General Hospital, you find a small plaque on which is written, "Here worked Dr. Donovan." Because he came all the way, because those days travel was not easy, and gave us uncovered the hidden nuances of Kala-Azar. So we have all the diseases happening. But the point is, till about maybe 1980s, we had only tropical diseases. That would be mentioned in the presentation also. Because we are a tropical country by our geographical location. But after the 80s and 90s, I'm sorry I'm not carrying any presentation, so I have the habit of talking ex tempo. After 1980s and 90s, we also have non-communicable disease in equal measure. In fact, way back, sometimes in the 90s, we have a very popular journal called Journal of Association of Physicians of India. Somebody wrote in a lighter vein, India enters, and the title was, India enters the age of civilized diseases. Now Indians die of heart attack. They don't die of tuberculosis. But currently, and more so after COVID, we have both. And this heat is affecting all the diseases, both the communicable and non-communicable diseases. Of course, it was being mentioned that the mortality increases. Of course, it does. And it's been mostly worked up or worked out in case of tropical diseases, because the Westerners have a fancy in digging out facts about diseases which are identified with Indians. So we have dengue being worked out there and telling us that there's a 20% increase in dengue per degree rise, about 30 degrees centigrade. True, of course, supported by evidence. But at the same time, those not having a disease like dengue, which is of course a communicable disease, those who having a coronary heart disease are equally susceptible to extremes of heat. also extremes of cold. Sometimes you need to advise a person suffering from a heart disease not to go for a morning walk on an early winter morning in December or January. So also in the case of several other diseases, even in diabetes, you can have something like a silent heart attack. If you suddenly expose yourself, you need not have 2-degree rise like dengue, even normal. Why? Because there's something called neuropathy. Nerves get affected. They don't have the kind of sensitivity that they're expected to have. So the person may not be able to appreciate, and his sweat glands are not that active. So once he walks out, you may sweat and get rid of it. He may not. And in the process, before he realizes, he might have undergone a heart attack. So what I'm trying to place before you, the learned audience, ladies and gentlemen, is that we have to have a very sustained Indian research as well. And therefore, I'm glad that DST is there, NDMA is there. And as I said in the beginning, it's no longer a seasonal phenomena. This year we experienced, because each day I try to learn something. I think the latest I learned is about this subject is that Delhi now has started having winter in summer and summer in winter also. Suddenly in the third week of March, when you thought the summer had arrived a little early this year, and you started sweating and pushed yourself into T-shirts, there was such a reverse gear. I had to travel that day from Delhi to Chandigarh, and I was taken aback. Everybody wearing jackets, woolens. They said it started raining heavily both in Chandigarh and Delhi. And then 3 days back, we have suddenly slipped into extreme heat. Now, there could be different reasons for that. Reasons again related to environment. So it is both cause and effect phenomena, as we sometimes tend to refer to it in this. The environment is the cause and the environment is the effect. The human body is the cause of our declining threshold levels, and human body is the bearer of the effect. And therefore, particularly the more vulnerable groups. And rightly now that we, as a responsible government, as a responsible nation, we cannot deny a few and let others have. So this issue of access to the cooling phenomena, or can you call it cooling inequality? Some of us are more cool than others. When I was sitting there, Mrs. Mendiratta asked me, why do you always appear to be cool? I said, whether I am not or am, I have to learn to at least appear to be cool, because I have no option. So the point is that this is something which is, and of course the more vulnerable now that we cannot have inequality of the conveniences available. And therefore it would not be fair perhaps if some of us are using air conditioners and coolers and others are deprived of it. And another peculiarity among Indians is, because I am talking totally in the context of India, because we need to have a totally India-focused research, is that we have for too long been a nation of have-nots. So now suddenly when we have started looking at the sumptuous feast, we want to grab everything that we have. Right now in this auditorium, I hope somebody would go and check what is the temperature. Dr. Radhika should have pointed out that we are also subjecting ourselves to more cooling than required. So I'm talking of ours. Sometimes our air conditioner rooms are cooled down to 15 degrees, 16 degrees, as bad as or worse than a December, Delhi December. The other day I was telling somebody, air conditioner is meant to keep away the summer heat. not to recreate the winter cold. And not only that, when we are talking of overall economy, mind you, there are statistics available. Each 1 degree lowering of the air conditioner costs so much more consumption of electricity. So when we are talking of heating, cooling, economy, sustainability, all this is so interlinked. So we are neither doing justice to ourselves, neither to those who are deprived of this chamber's temperature. If we could reduce the air conditioner, that means raise the temperature, possibly we could save on the electricity, which in process would also save on the national economy, which could be then diverted to those who are not affording it. So, as I said, we are a part of the problem. We are also possibly, to an extent, the etiology, the cause of the problem. And we are also trying to look for the solution. And therefore, we have to find the solution right here. It lies right in this room. And I'm glad India has already started what is called India Cooling Action Plan. Prime Minister has been repeatedly speaking about it at the most important platforms. He gave us the mantra of life. And the India Cooling Action Plan, I was just checking, it's already been rolled out in as many as 250 cities of this country. But at the end, I would just say that more than anyone else, we have a huge stake. Because we are if you talk only of this subject that we are discussing this afternoon, we have multifactorial reasons for creating this condition amidst us, which may not be so in case of a more homogeneous European country. Secondly, not only we have a stake in this, the whole world has a stake in us. We are the most populous country in the world. We have overtaken China as well. Often you tend to curse yourself for this, but see, there is also an advantage. The world can't do without you. You are 1.4 billion, and put across with China, you constitute almost half the world's population, which is just about 8 billion or so. So if you fall sick and your dengue spreads, the rest of the world has a stake. And therefore, that's right. That's the reason why when COVID happened, the entire world was looking at us, how well we manage. So dengue spreading out from here can reach there. Already, for example, I was talking about the tropical diseases. In the 19th century and in the first half of the 20th century, you never had a single case of tuberculosis or leprosy in US or Europe. That's the reason the terms came here. But after this HIV happened somewhere in 1980s, now they too all have tuberculosis there. Because their immunity status is also getting compromised. So therefore, India with its 1.4 billion population holds stake for the entire world. And the entire world holds stake with what we do. But yes, we can do it. And we should start doing it right from this room, first by checking the temperature and setting it right for the next subsequent sessions. I would be mercifully walking out, but you take care of yourself.
Thank you so much, Honorable Minister. Very informative, encouraging, and truly inspiring. I request Ms. Deepa Bagai to please deliver the vote of thanks.
Thank you, Prima. Good afternoon, everyone. It is my great pleasure and honor to be standing here thanking Honorable Minister for his very insightful remarks. The thoughtfulness with which he presented the issues, with which he analyzed the problem and even suggested the solutions, is really something that we look to in our leaders. Thank you, Honorable Minister, sir, for being that leader. I do want to say that it is extremely encouraging to see the continued leadership and engagement of the leadership on extreme heat. Dr. Krishna Vats mentioned that even the Prime Minister takes a briefing on heat preparedness, which will be happening soon, as does the Home Minister. And our partners here, NDMA and DST, play a really important role in that, as does CDRI, in building resilient infrastructure. I also want to say that the presence of the minister here reinforces a very important fact, that these conversations matter. All of us who have heard the minister here today will go back with some of those insights into our work. We will take back with us what the minister has said, including just walking out of the room and trying to adjust the temperature. We are very, very fortunate in our continued collaboration with the Department of Science and Technology. We are constantly working on developing innovations, right from things like affordable, cheap, efficient fans, because air conditioning is not the solution to our problem. As Dr. Radhika and Dr. Adele pointed out, the situation is far more complex, and thermal comfort is a necessity. There is a huge equity lens to this also. So I do want to thank Dr. Radhika Khosla and Dr. Adele Thomas for grounding our discussion in science. The presence of the minister as the Minister for Science and Technology and so many scientific departments that he heads, including his own scientific temperament as a very well-known, renowned diabetologist in his earlier days, but also with the advice, medical advice he gave us, that is something really to be appreciated. I would also particularly like to thank the minister for bringing the health issue first and foremost into the climate discourse. That is an issue which has so far gotten a bit neglected. I think it is really important for us to bring that front and center. I do have to assure you, Mr. Minister, that NRDC has three main pillars that we work on: nature, climate, and health. And health coming into the climate space, and NRDC and other organizations working together in that space is, I think, where our solutions lie, because it is ultimately the health of the human being that will determine the health of the planet. So I think I would like to acknowledge all our partners for all the voices that they have brought into this room. Bringing people together like this is not easy. I want to compliment Prima, the entire heat and cooling teams that work at NRDC, and all our partners for being here and providing us this kind of alignment and momentum that is needed to respond to this huge challenge, the challenge of extreme heat. One of the most important announcements that I've been waiting from the morning to do, and was waiting for the arrival of Excellency Minister Dr. Jitendra Singh, is that it gives me immense pleasure to announce that NRDC is proud to be part of the Global Heat Health Information Network South Asia Hub, which we are starting here. Again, this is not something that one organization can do. It is to be launched tomorrow, housed at CEEW, in partnership with NRDC, Sustainable Futures Collaborative, UNSCAP, and Brack School of Public Health. This is one of those initiatives which will have a lasting legacy impact, because it will bring together this regional collaboration, knowledge sharing, and action on heat and health, which is absolutely critical, I think, to the way we address extreme heat. I just want to say that at the end of the day, we are faced with challenges, but like you said, we are that population that is able to adopt, adapt, and give lessons to the whole world. So I would just like to end with the Urdu couplet by Jigar Muradabadi Sahab. अपना ज़माना आप बनाते हैं अहले दिल, अपना ज़माना आप बनाते हैं अहले दिल, हम वो नहीं कि जिनको ज़माना बना गया. So with that, I want to say that let us make our own zamana, and thank you for your leadership, Excellency Dr. Jitendra Singh ji.
Thank you so much, Deepa. I request Deepa to please felicitate the Honorable Minister with a small memento.
Call upon the heat and cooling teams to come here quickly for photography. Both hot and cold together.
Excellent. Great. I invite all our guests to please join us for lunch. We are running a bit late.